Welcome to Cork University Hospital. This is a patient information video about CT scans. On the day of the procedure, you will enter the hospital via the main entrance. Next, you will pass reception on your left and continue down a long straight corridor. Before your scan, you will receive a letter with information about the date and time of your appointment. The radiology department is located on the ground floor. You can either take the lift down one floor or take the stairs as shown. If you enter from the accident and emergency side, you will already be on the ground floor. Simply follow the corridor until you see the sign for X-ray. On your arrival, check in with administrative staff at the reception who will direct you where to go from there. Once we are ready for your scan, you will meet one of the radiographers who will be looking after you for the day.
Hi, my name is Erica and I'm one of the radiographers here in Cork University Hospital, and on the day of your scan you'll be meeting myself or one of my colleagues. A CT scan is a type of 3D X-ray that can be used to investigate new symptoms or to further investigate known conditions. There are many types of CT scan. This test can be performed on all areas of the body and can be done either using X-ray dye or without X-ray dye. Depending on the type of scan you're having, you may be required to drink oral contrast. This helps radiologists reading your scans to assess your stomach and bowel more accurately. If your scan involves this contrast dye, then please be aware that you may have to drink this over 60 minutes prior to your scan. The same X-ray dye might also need to be given through a vein in your arm. For this, you would require a cannula, which is a small plastic tube that is placed in the vein by one of our radiographers or doctors. Some scans won't require you to have any X-ray dye. To prepare for your CT scan, please ensure that there is no jewellery or clothing containing metal around the area that we're scanning. You may also be asked to fast for a couple of hours prior to your scan, and this will be on the instructions that you receive. The use of X-rays means that you are being exposed to radiation for the test. The amount of radiation varies depending on the type of scan you're having, but the overall risk from this is quite low, and the referring doctor has determined that the benefit of having the CT scan outweighs the radiation risk involved. If you're of childbearing age, we may ask a few questions about your last menstrual period or prior pregnancies. This is to ensure that there is no risk of you being pregnant at the time of scanning, as radiation poses a risk to unborn fetus. The safest time to have the scan is within the first 10 days of your menstrual cycle. Now that all of our checks are done, it's time to get you in for your scan. Once you're ready, we bring you into our CT room where you'll see a large donut-shaped machine with a table in front of it. This is the CT scanner. Depending on your scan, you will need to lie on the table on your back or on your stomach, head first or feet first. We will direct you and help you move into this position. If you have any mobility issues, please let us know and we can assist you when moving on and off the CT scanner. Once on the table, if you are having X-ray dye, we will connect a small tube to the cannula in your arm and test to make sure that this line is working. Next, you will feel the table move into the scanner as we do a low-dose planning scan to accurately plan the area we're scanning. Once the scanner is ready and the right settings have been chosen, your scan will begin. Depending on the scan you're having, you might need to hold your breath. We will announce when you need to do this. Don't worry, you only need to hold your breath for a few seconds. This helps us get better pictures and makes it easier for the doctor reading your scan to interpret the study. If you're receiving an X-ray dye, you may feel warmth when it's injected, and you might feel like you have gone to the toilet, but you won't have. You might also get a metallic taste in your mouth. These sensations will only last a couple of seconds. Once the scan is complete, we will guide you back outside. If you have been injected with X-ray dye, we will keep you outside for 10 minutes just to ensure you don't have a reaction. After this, you will be free to go home, and your scan will be reported by one of our radiologists and sent to your referring doctor. I hope this video has alleviated any concerns or fears you may have had about your upcoming CT scan. If you do have any remaining concerns, you can contact us on the following numbers. Thank you for choosing Cork University Hospital.